Hello everyone, my name is Lauren Arnold and I'm a biomedical engineering PhD student at Virginia Tech, and I'll be presenting on the histotripsy treatment of primary osteosarcoma, a feasibility study in excised canine tumors. Osteosarcoma, or OS, is a type of cancerous, highly metastatic bone tumor that occurs spontaneously in both dogs and humans. Previous studies have shown biologic similarities in OS between the two species, making canine OS a good preclinical model for future human work. Currently, osteosarcoma is treated by surgically removing the local and metastatic osteosarcomic lesions. In both species, OS most commonly occurs in the appendicular skeleton, so surgical removal of the primary tumor requires either limb amputation or limb salvage surgery. In dogs, limb amputation is the standard of care. After surgical removal, chemotherapy is administered to treat any micrometastases and to prevent further metastatic spread. Unfortunately, OS prognosis is poor, especially after metastasis. In humans, long-term survival rates have been stagnant for decades, while in dogs, only about 45% survive for 1 year, even with definitive treatment. Histotripsy is a non-thermal, non-invasive focused ultrasound ablation method that uses acoustic cavitation to disintegrate tissue into subcellular components. Histotripsy uses high-pressure ultrasound pulses to generate a cavitation bubble cloud that ablates the target tumor with millimeter precision. Histotripsy has been previously evaluated for the treatment of liver, breast, and kidney cancers, but has yet to be tested for the treatment of bone tumors. Figure 1 provides a visual of histotripsy's mechanism. On the left, a focused ultrasound transducer is seen. From this transducer, short, high-pressure pulses are sent and focused inside a target organ or tumor tissue. These pulses generate a cavitation bubble cloud, shown in the center, which expands and then violently collapses to mechanically ablate tissue. On the right, an example histological analysis of tumor tissue treated with histotripsy is shown. Notably, a clear boundary is observable between ablated and non-ablated tissue. In this study, the feasibility of treating primary osteosarcoma tumors with histotripsy was investigated using a custom-designed focused ultrasound transducer on excised canine osteosarcoma tumor samples. To accomplish this objective, osteosarcoma tissues were first surgically resected by the team at the Virginia Maryland College of Veterinary Medicine in Blacksburg, Virginia. After being given to the engineering team, excised samples were embedded in a gelatin tissue phantom and then treated with histotripsy at optimized pulsing parameters within 48 hours after harvest. After treatment, tissues were fixed in formalin, processed, and stained with a hematoxylin and eosin stain to assess tissue structure after treatment. Figure 3 shows the experimental setup of the histotripsy system. The histotripsy system consists of a custom-built array transducer, driving electronics, and 3D motorized positioning systems for robotically assisted volumetric treatments. Real-time coaxial ultrasound imaging was utilized to locate the bubble cloud and to monitor bubble cloud dynamics throughout treatment. In this study, a 500 kHz histotripsy transducer was used. 1 to 2 cycle pulses were sent at a repetition frequency of 250 Hz. The tissue volume treated varied depending on the excised sample size, and at each treatment point, 4,000 pulses were generated before moving to the next point. In all samples, a cavitation bubble cloud was generated at peak negative pressures between -30 and 40 megapascal. 7 samples were treated consisting of only tumor tissue, and 1 sample was treated through overlying intact skin and muscle tissue. In this sample, pictured on the right, a robust bubble cloud was formed without a notable increase in required pressure. The 2 videos on this slide show a histotripsy bubble cloud during 2 canine excised OS treatments. Bubble clouds are observable in real time on ultrasound as regions of hyperechoic oscillating zones. In the right image, the arrow indicates the overlying skin and muscle layer between the histotripsy transducer and the tumor tissue. Overall, the excised osteosarcoma treatments performed in this study demonstrated that ablation of OS tissue using histotripsy was achievable. For all samples, hematoxylin and eosin stains were used to assess tissue structure after treatment. Before treatment, histological analysis showed variably dense populations of neoplastic cells effacing cortical bone with light pink osteoid matrix. Non-treated cells were readily identifiable. After treatment, a complete loss of architecture and cellular detail was observed. Only cellular debris was observed in histology. Using the same experimental setup, the effects of histotripsy on healthy canine bone and nerve were also tested. At consistent treatment parameters, no histological differences were noted between treated and untreated critical structures. In conclusion, 9 excised osteosarcoma tumors were treated in this feasibility study. As discussed, results demonstrate that treating canine OS while preserving adjacent normal tissues is feasible using histotripsy. Recently, our group has started an in vivo trial funded by the Focused Ultrasound Foundation Veterinary Program. On the right, images can be seen of our first Histotripsy OS patient, along with our experimental setup and a video of the bubble cloud inside the tumor. In the top right-hand corner, the debilitation of these tumors is clearly obvious by the patient's struggle to walk in the video. This work is still ongoing and will investigate the in vivo feasibility and immunomodulatory effects of Histotripsy treatment for the treatment of OS tumors. I'd like to take a second to thank the members of my lab, especially my advisor, Dr. Eli Vlasovlovich, and our funding sources, particularly the Focused Ultrasound Foundation. Thank you for taking the time to listen to my talk. Please reach out if you have any questions.